All right, back to coronavirus. Seems every time we get a set of answers, it inspires a new set of questions. Still so many questions about this virus. Our Dr. Frank McGeorge has been working tirelessly. Actually, I shouldn't say tirelessly. He may be tired, but working continuously to find answers to those questions.
And this evening, he's addressing new questions regarding kids and their susceptibility to the virus. And that obviously really hit our radar with the news that happened in Oakland County a couple days ago.
Exactly, Karen and Devin. As new cases in the state have been revealed, one thing that came up is that one of the cases in Oakland County is described as a male child who we believe is only 5 years old. I've been reporting that this illness, of course, is more severe in older people. So what about kids?
Viewers from all across the area have asked, does the coronavirus infect children? Well, the answer is yes, but there are many differences. The severity of the infection is much worse for people over 60 and generally much less significant in children. Early studies showed only about 2% of infections were in children, but with more study it's become clear children do become infected, but they have much milder illness and probably just weren't being tested. A newer study finds the actual percentage of cases that are children is closer to 13%. Now, because children appear to have much milder illness but can still be infected, the importance is that children can spread the illness and may not be very ill. So maintaining social distancing and good hygiene in children is very important, especially as COVID-19 becomes more common in the community and they become spreaders of the virus. Now, viewers from St. Clair to Trenton want to know, does being on an immunosuppressant medication increase your risk? The answer is yes. Now, that answer is not based on any scientific study specific to coronavirus. It's based on what we know in general about the effect of viral infections in immune-compromised people, coupled with the knowledge that the virus affects people with other documented medical conditions much more significantly.
Now, I expect that in time we will have better data on the degree that immune suppression puts someone at risk. But without a doubt, anyone with a compromised immune system, whether it's from a medication or cancer, they should take extra caution. Also, do not stop your medication because of coronavirus. You should talk to your doctor. Now, there has been a lot of talk about whether it is safe to use ibuprofen to treat the coronavirus, and I will have more on that coming up for you at 6 o'clock tonight.
That's fascinating. Make sure you're with us for
that.